Early Childhood Partnerships is a community-based consultation, training, technical assistance, and applied program evaluation research consortium. We're obviously the 5th core division of the Office of Child Development here at the University of Pittsburgh, but we're also still affiliated with Children's Hospital of Pittsburgh, and we're affiliated with the Lens Center at the University of Pittsburgh, which is a maternal and child health leadership training institute in developmental disabilities. Our first core program is called SPECS, S-P-E-C-S, stands for Scaling Progress in Early Childhood Settings, and we're devoted to using authentic assessment and authentic program evaluation research methods, which means that we don't do any tabletop testing. We collect only real-life data from real-life settings by people in their routines. And we do this through a variety of really pretty rigorous methodologies. In some cases it's videotapes, in some cases it's data collection through observation. There are a variety of different methods that we use that are field validated, and we've had quite a track record with this. So SPECS is our first core program. The second one is called Healthy Child, and it was originally a federal grant for 5 years that field validated what's called a mobile developmental health care team. And what that means is that a team of generalists and specialists travel to children right in their natural settings. We deliver services and supports to teachers and families in Pittsburgh Public Schools. We're the healthcare provider for children 3 to 5 years of age in early Head Start, pre-K programs, family child cares. We're also the healthcare provider for Beaver County Head Start, for the Northern Panhandle of West Virginia Head Start, and we have been providers for Westmoreland County Head Start and for CoTrack. Our third core program is called COMET, Center on Mentoring for Effective Teaching. We had a federal grant that just ended where we field validated a 6-step model, a very structured way that on site a teacher is mentored and their professional development is enhanced, and they actually get credits from the University of Pittsburgh by engaging in that mentoring model. Our fourth core program is called Civic. It stands for Center to Investigate Violence and Injury in Communities, and the Associate Director of Early Childhood Partnerships, Dr. Joyce D'Antonio, is an epidemiologist, and Civic is devoted to collecting large data sets with the Allegheny County Police Department, with the Center for Disease Control, with the Allegheny County Health Department, as well as the police, with a variety of other entities, and many of their projects are focused on collecting data on patterns of violence so that they can make decisions about prevention strategies eventually. So, for example, with the casino coming onto the north side, we want to know, did that change patterns of violence? The fifth core program is called TRACE. It stands for the TRACE Center for Excellence in Early Childhood Assessment. This was a federal grant we had with my colleague in North Carolina, Dr. Carl Dunst, and this was actually his grant with Dr. Carol Trivet, but I was a co-investigator on it for 5 years and actually 5 different staff members of the Office of Child Development in those days were part of the Trace Center. We were tasked by the Office of Special Education Programs in Washington to look in depth at what is the evidence base for early childhood assessment practices, mostly for declaring eligibility for early intervention programs for children with suspected or confirmed developmental delays. And lastly is a small program called Early Childhood Research Systems, and that's for any time we develop a measurement format or strategy or research tool, it goes under that program. And we've developed a number of our own measures of early literacy skills, of actually clinical judgment tools, measures of the severity of developmental disability independent of what diagnosis that you have. And we have a couple of graduate students doing research using those classification formats and so forth.